Welcome, everyone, to Planetary Health First, Mars Next. We got a great show today. Happy Thursday, Good Friday already, tomorrow to those. And we got Suzy Engwall, and she's a friend of mine. I can call her a friend. I know her. I've talked to her several times. She's in this startup ecosystem, healthcare ecosystem, med tech ecosystem. She's a champion to all things digital hospitals, trying to make these things go in innovation. And she's going to share with us today everything that could be going well, going wrong. Why is healthcare innovation so hard? That's what we're going to be discussing. Suzy, if you could just share a little bit with our audience about you.
Sure. So I have been in healthcare for, about 17 years now. I spent about the first 10 of those doing process improvement inside of a large health system here on the West Coast. And really was a little bit disheartened with it because it was, let's get everybody together to solve problems, but you can't spend any money, you can't have any new tech, and you can't have any new staff. It's really hard to solve problems when you've got, barriers, and then people have to go back to work, and aren't able to implement a lot of changes. And so that kind of led me into the healthcare innovation side of things about 7 years ago. And as soon as I came over to the innovation side and I realized, hey, there's ways that we can fund fixes for a lot of these problems I've been seeing for years, it opened up a whole new world to me. It was kind of mind blowing at the time. I'm like, what? There's like a space for this? Like people actually are working on this? It was something that really wasn't happening a lot back then. So I'm glad to see this space kind of increasing and growing, but I love the healthcare innovation side. I love seeing new products come to market. I love working with early stage innovators. So I've been doing that for quite some time now. I moved over to Alera Health about a year ago, almost a year. It'll be a year at the end of this month. And I'm really enjoying working there and kind of seeing a different side of the business, working more with startups on their capital raises, or working more with startups that are a little bit further along than I was when I was first started in the innovation side at an incubator. But I love both sides of the business. I'm really excited to be here today and to talk about some of my learnings along the way.
So I guess the first question for you today is, what are some of the biggest challenges you see in healthcare innovation today? What is the biggest challenge?
Yeah, I mean, there's a long list, but, of course I have to address sort of the elephant in the room with the latest bank failures and other things going on. Capital right now is hard. And that it really does address kind of today. We went through this heyday for the last couple of years where I think a lot of companies were overvalued. I also think, there was a lot of money kind of free flowing and kind of going back and forth into these companies. Part of me thinks that, the capital side actually might be a little bit of a good thing because it's giving us a chance to take a step back and kind of correct some of the things that maybe have a better idea about what valuation should look like in this space and that kind of thing. So I think that's going to be a challenge for at least the next 6 months or so. We may see it go a little bit longer depending on what happens with the economy. There's a lot of things at play here. But I also think there are ways that you can look for alternative forms of financing. And we can talk about that a little bit in a minute if you'd like. But some of the other things that I think are challenges, one of the things that we've heard about for years and that I don't really hear about as much anymore is interoperability, but it's still a problem. There are some newer solutions to those to the interoperability problem, but it's one of the bigger challenges that we have. And it's one of the reasons a lot of like digital health companies, for example, can't get off the ground. Maybe they're not integrating with the EMR and they're taking, physicians out of the workflow. So they're not able to actually use their product, or they're not getting product adoption because of that. Data is another one. We are hearing a ton of things about, the use of artificial intelligence nowadays with Chat, GPT, and all the other things that are out there. I think, when we think about using AI in healthcare, there's a huge need for it. There's a lot that it can do for healthcare, including, predicting, what might happen with the patient, clinical decision support, even helping with diagnoses support. The challenge is going to be, how do we clean up all of this data and how do we get hospitals to share some of this data so that we can actually make these things a reality? The other two kind of things that I think about when I think about the challenges in healthcare is, when you have small market sizes like you often have in pediatrics and rare diseases, those don't get funding. And it's really too bad, because I really feel like those are places that innovation is needed the most. It just so happens that the market sizes are very small.
I like that you shared that. That's unfortunate. And I imagine that's also sort of like rural health, just is such a
Mhm.
huge need, but it's so hard to address and to execute on that. So good
Absolutely.
point.
I think it's one of the more overlooked areas as well. I think there's a lot more discussion about it in the last probably 12 to 24 months, especially with COVID coming into play. There's a lot more folks talking about it and working to address it, but I just don't see a lot of solutions on the market yet. Hopefully
So
they're coming.
I know you were addressing, sort of sharing in the last comment about the innovation in healthcare. What are some trends that you're excited about in healthcare that you see helping, the good and the bad with some of these trends?
Yeah, I mean, I already kind of addressed the artificial intelligence space, but AI and ML are big trends right now, just like blockchain was a couple of years ago. We still hear about blockchain a little bit, but I think AI and ML can be big game changers in this space, but it has to be done correctly. And we have to, make sure that we protect patient information. We have to make sure that that we look for, I guess, unintended consequences that may come about from it. I think it's going to be a big source of discussion, not only in healthcare, but everywhere for the next few years. And it'll be interesting to see how things play out. Other trends that I'm kind of seeing, obviously with COVID, kind of coming and going, remote patient care is a huge one. A lot of people have realized now, hey, we can, be at home. We don't necessarily have to stay in the hospital. There's ways that we can be taken care of. And so there's a lot more coming out on that side of things. Telehealth obviously goes right along with it. I think telehealth still has a few challenges. There's a lot of companies that kind of came out of the woodwork to kind of jump on the telehealth bandwagon. So it'll be interesting to see who's kind of left standing a few years from now and what happens with the adoption of it now that we're all kind of back being able to go to the hospitals if we choose to.
Yeah, Susie, I had a conversation today with a healthcare executive of several hospitals, a system, and he was really bullish. One of the things was on the hospital at home, and he just said, let's just do a subscription model. I don't know. I thought that was fascinating, but I was blown away that I'd hear that from a hospital,
Yeah,
finance operations person. But I thought that was kind of bullish. So
it does seem a little bit like it. I'd love to know what that model might look like for them, because I can see something like that potentially working. And if it would maybe help them cut down on their cost of having, a larger footprint, maybe needing less space, maybe there's something to that. I don't know. I would love to learn more about kind of what was behind that comment. That's really
yeah,
interesting.
there's a question I'm putting up there. It's I think it's from Dr. Michael Connors, and for whatever reason, it's not pulling through the name today. But were companies overvalued, or were the wrong solutions invested in related healthcare? And that, I believe, is from Dr. J. Michael Connors.
Oh, yeah. Hi, Nick. You know what? That's an excellent question, because you are right about that. I think it's probably a mixture of both. There are definitely some companies that I can think of, and I'm not going to name them because I want to be respectful, that I can think of that I know were way overvalued and probably got a lot of money because of that and have had bad things happen since then. But I also think you're probably right about that. There were some that invested in wrong solutions. And I think when we think about how we work with VCs and we work with, institutional investors, it's really important that we align ourselves. Like if I'm a startup, I think it's really important that I align myself to somebody who really understands our industry and really can also kind of help get you where you need to be. I think those kind of investments are much more valuable, and then they're also less likely to invest in the wrong solutions at the same time. But I do agree with you. I think there's a good mix in there for sure.
We have another question from the audience, Ning Gao. And before I put that on the board, I just wanted to do a follow-up on how do you test these things out? How do you figure out, like, prototype? How do you do some consumer market research before you put the boat out there? What would you recommend?
Well, I am a big believer in the value of design thinking, and I'm a big believer in going back to your customer base and your payer base. It's not always the same person. The person paying isn't always necessarily the end user. over and over and over again, repeatedly. Because what I have seen with a lot of startups over time is that they'll, say, hey, here's a problem, here's how I'm going to address it. I've spoken with, a handful of customers, they all agree that this is a good idea, and then they go off and build, and they never address that customer base again. And if you ask 5 people about a solution to a problem and 2 people give you the same input, that doesn't necessarily create a majority, number one. And then number 2, so you have to have a wider pool of people that you're asking. And then number 2, you have to keep going back to the well. So, and the thing that I really like about design thinking is every step along the way is an iterative process. So I talk to my customers or my potential purchasers first. Then I go and I really work to define my problem in a really very clear and consistent way and bring it back to them and say, hey, am I asking the right question here? Before I spend any money investing in building something, is this the right question? Oh, great. Now I'm down to the right question. Now I'm going to start building a prototype. But before I even build that, I'm going to make a representation of it. It's going to be a down and dirty representation. It could be a drawing. It could be, something I build with, little things I find in my house. But I'm going to build something that's going to show you what my idea of the solution is. And I want to get all of your feedback on it before I go further. So I think, you've got to do this at every step of the way. Then once you get that feedback and you start building, you've got to keep going back for feedback over and over again. If you're building a minimum viable product, the other thing that you need to do is keep it to that minimum viable product. So there's a couple big places I see companies kind of start to fall out. One is, number one, not getting that customer input and that customer feedback. And it can be hard to find, but don't be afraid to tap into Facebook groups or Reddit groups or any of these other social media groups. Don't be afraid to pick up the phone and call a nonprofit charity that's working in the space you're working in and say, hey, how do I get in touch with your patients? I'm building something that might be useful to them. I think there's ways that you can find, customers and patients in whatever it is that you're doing. And another downfall that I really see is going out and spending a whole bunch of money on something without having that user feedback. That often can lead to disaster. So please just make sure you're always going back to that customer group, and the more the better. Did that answer your question, I hope?
Oh, that was great. That was excellent. I loved how you illustrated the whole kind of the process of design thinking. You just concisely said that, and just how it works, why it's so important. And I posted this. Are you able to see on the board the question?
I can.
So I'm not exactly, it's not a question. It was just more or less kind of re-emphasizing what you had. Does that make sense to you? And do you want to address that?
Yeah, and I'm assuming everybody else that's here can see it too. But the comment is about CHAI, and it's the Coalition for HealthAI.org. I do think that, as we continue to move forward, we're going to need these kinds of groups. We're going to need some type of oversight. We also need really good places to test. One of my good colleagues and I have been doing a lot of talking about using AI in radiology, and how, there's a lot of companies that have spun out that are doing this, but they're testing it in one venue or one environment with one type of equipment, and the algorithm works great. And then they go to another venue in a different environment with different equipment, and all of a sudden it's not as accurate. And there's reasons for that. So I think as we start to move down this path, we need to make sure that we've got multiple environments to test in, that we've got somebody kind of maybe a little bit of oversight. I don't necessarily think it needs to be governmental, but I think this is something that we could do as a healthcare group. But there are going to be some great applications for it, but we do also have to be careful. So I really appreciate whoever posted that, bringing that up.
Yeah, that was a friend of mine. And not everyone's my friend, but if I've talked to you maybe once or twice, you're my friend. So I try not to have enemies. But anyway, so that was Ning Gao, and her follow-up to that, which I think is really good. And her question is, there are many issues blocking or slowing down innovation that can't be solved by a single startup. What are the top issues the innovation community needs to rally and solve as a whole? What needs to change so the community is a force, not individuals? Great question, Ning.
Fantastic question. I think there's a couple of different things. I could probably talk about this question all day long, and I could probably find you 25 different topics, that kind of rolls up to this. I think there's a couple of things. And one thing that I think could be a little bit more easily solved is sort of this disconnect between, hey, I'm the entrepreneur, I'm building my startup. now you need to go out and get funding. Now you need to go out and get pilots, right? How do we bring the ecosystem closer together? And I think a lot of people are doing that with venture studio models right now, where they're bringing together the healthcare system, the investors, and the entrepreneurs, deciding together what problems they're going to go out and attack, coming up with some potential solutions, then picking one and moving forward. This could really accelerate innovation quite a bit. If you come out with if your startup, if your MVP has support of a hospital to pilot in and a lead investor from the get-go, you're going to have a much faster path to market, which I think is going to make a huge difference. I think with the community kind of rallying together to solve it, there's a lot of problems that come from the EMRs. I think we all know that. It's not to say that they're bad companies, but there's a couple that really kind of corner the market, and it's how do we work better with them? How do we help them, or how do they help us? Take our products and integrate them so that we have more integration, so that we're better. It's better for us to work with them. I think right now a lot of startups don't want to work with some of the big EMR groups because they have to pay a lot of money in order to do so, or give up, things that they don't want to give up, and that makes a lot of sense. But if you are disconnected from that system, and that's what the physician's working in, you're not going to get a lot of adoption if the physician's the one using the product. So I think there's things like that we need to kind of solve. I think we also need to look at alternative forms of financing. So I think, the more grants that we can get, the more non-dilutive financing that we can get, even things like crowdfunding. How do we support that as a community, as a healthcare community? And, I have a little bit of bias there because Red Crow is part of the Alera Health community. So I don't want to
shout it out right now. Go ahead.
Yeah, but I do think, if we are a big group of healthcare, we've got this big, huge knowledge base, right? And one of the reasons that I never really invested in healthcare companies through like crowdfunding before was because I'm like, who is looking at this? If I'm positioned next to a new type of whiskey and a Kardashian-inspired clothing line, who is betting this healthcare company? How do I know I'm not placing my bets on the next Theranos? So I think if you've got some oversight of that, that will help. I also think, we've got a lot of physicians that want to invest in companies now too. So even though they're not necessarily your quote unquote angel investors, that's really what they are. If we can find places to showcase a lot of this innovation to them, I think that will help too. Funding is going to be probably a bit of a challenge for the next little bit. And I think right now kind of the ball's in the court of the VCs and for the institutional investors, and they're asking a lot more from these early stage startups or even later stage startups. And it's just kind of the way the market is. So we have to kind of get around that too. Well, what I guess I'd like to know from the person who asked this question is there any specific topic in mind that you would like me to talk about?
Yeah, Ning, you were out there watching maybe, or maybe you went, I don't know. But if you want to have a follow-up, that'd be great. But we have other questions from the audience, so we can come back to that.
Sure.
This is Carrie Patterson, and are there discussions on how to address the 4%, meaning AI, ML is mostly 96%? So if your diagnosis is wrong or claims are denied, what is the recourse for patients who fall in the 4%?
Well, I think especially now when we're at early stages, my personal opinion is that you still need a physician's eye on everything that you're doing. So when we're talking about clinical decision support, that's exactly it. It is support. When you're having AI look at scans, for example, in the radiology side of things, it may find something that our eye may miss, especially because a lot of folks are under pressure. Like, I've got to get this patient in and out. I've got to get to the next one. If they're, in the ED, I think a lot of times they have like a 20-minute time frame in order to go back and look at those scans and get back. So I think it can be a real help in a lot of spaces, but I also think that physicians and clinicians still need to be heavily involved. We may get to a time, many, many years from now when AI can solve all of our problems, but I just don't see that happening. I think, there's some discernment that goes into a lot of this. And so it can tell us what's on the scan. It can tell us, hey, I saw something that looks like it may be an issue. But from my perspective, I still want my physician looking at it. And I don't, 94% accuracy may actually be a little bit better than what my physician would normally give. I don't know the percentage of accuracy for every doc that's out there, but we're all human. We all make mistakes. And so I would imagine the recourse has got to be something similar to that, but it is a subject that we need to talk about. How are we going to handle these things? And I think the key, it really is having that human interaction with the AI models as well. If you're relying on AI 100%, to me, I just don't feel like we're there yet. That's just my personal opinion.
Yeah, no, great answer. Great question. We have another one. You kind of covered it, but I think it would be good to kind of, so how can early stage startups connect with clinicians, physicians, and the health systems to help get validation early on before they spend so much money for prototype and MVPs? And I know you kind of addressed this, but if you want to just kind of help answer this.
There's other ways too. And I know a lot of startups don't always want to work with accelerators or incubators. Maybe they feel like I can do this on my own. But one of the things, and maybe you can build your business from the ground up. But one of the great things that groups like that bring is physician mentors, physician influencers, hospital systems that can give you feedback, that can take a look at what you're doing. And some of these accelerators are even tied to hospital systems. We've got Cedars-Sinai Accelerator here in LA, and they're a great one. I know some companies that have been through it. Not only did they get a little bit of funding, they also got, to do a pilot at Cedars-Sinai, and then they got feedback from within the hospital system. Picking up the phone and cold calling is probably not your best alternative. There may be ways that you can reach out to people on LinkedIn or add a mentor to your team or an advisor to your team that already has these connections and can pick up the phone and call some of these folks and say, hey, would you mind looking at this startup for me and giving me some feedback? That's the thing, is that, you have to get a little bit creative about finding who some of these people are that may be your customers. And on the physician or healthcare side, it can be a challenge because they're very busy, and we now know more than ever they're short-staffed.
Mm-hmm. Excellent. We have another question. It's a little more specific. How about just getting patients to take their medication? And this is from Harvey, and I imagine there's some really cool prototypes and stuff that's come through your pipeline. Tell us a little bit about that.
Yeah, people have been trying to address this for a while now. Everything from, a sensor that can tell if your pill bottle was opened, but we still don't know exactly if you took the medication or not. I know there was a startup that I spoke to not too long ago, and of course I'm drawing a blank on their name, that actually has sensors built into the bottle that can tell how many pills were actually dispensed. We still can't tell if it went down your throat or not, but at least that kind of helps. I think medication compliance is so hard. And if I had the magic bullet and the answer to that, I would definitely be running my own startup doing that. I think, treatment adherence is another one. I just saw your follow-up to that. I think, with some of the things that are out there right now with remote patient monitoring and some of the sensor technology that's out there, and, there's a company that I'm talking to down here in Southern California that can actually at least tell if a piece of equipment, maybe a plugged-in piece of equipment's being used or not. There's ways that we can kind of do that, but, docs they can't be on a telehealth appointment every single day to make sure somebody's doing their treatment. These are really tough questions, and I know there's a lot of startups that are out there trying to help advance both of these questions, medication and treatment. I think if people can do it in the comfort of their home, I would hope that that's going to bring us more improvement in that space. But I will tell you, I'm a culprit. I have tennis elbow. I've had it for a while now. My arm hurts like heck. And there's exercises I can do that my doctor gave me, and I don't do them. And I know I should do them. It's just when my arm hurts, I'm in the middle of something, I can't do them. And then when it's not hurting, I don't think about it. So it's been, it's a challenge for sure. And, that's an easy example. But I think when you have somebody like when you're diabetic, for example, that's a huge issue if you're not complying, because there are a lot of things that can happen. And I think a lot of people don't realize that. We've got a lot of the population, that are pre-diabetic and have no clue, a huge percentage of the population. And so they're not managing it or treating it, and they're only going to get worse. And I think a lot of people just aren't educated on what non-adherence really can do to you and what the results of that can be. I wish I had a great answer for you. Believe me, if I did, I'd probably be a millionaire.
I think a billionaire.
Yeah.
Yeah. Well, this is great. What gets you excited? What gets you excited about the field you've chosen and what you do?
Yeah, I mean, I think for me, being in healthcare, I've just seen a lot of stories and a lot of challenges that families have had. And for me, it's about making a difference in a very small way. Like, I'm not changing the game for these healthcare patients in the way the startups I'm working with are, but helping them get to where they need to be and just sort of making that little mark or that little impression to help propel them forward to make a difference for these families. And especially in the pediatric space, I have a real passion for pediatrics. And a lot of it is because it's often underfunded in the innovation space. Market sizes are small. I think we have to be creative around how we get things moving forward. And I think a lot of people don't realize in the pediatric space that FDA has some incentives that can actually get your product to market faster. So if you start on the pediatric side and expand to adults later, it may actually be better for you as a startup. It's really hard to start with adults and go backwards. And anybody who works in pediatrics will tell you they're not little adults. They have a different, the way that their body responds to things is different than adults. It's just the way that it is. They're still growing, they're still changing, they're still, evolving, and it's just a different space. But anytime I see like a new startup that's solving a big challenge that I've known about for a long time, that's what gets me excited. That's what gets me out of bed every day. Having these kinds of conversations with folks like you gets me excited. I just have a true passion for the space. And I've had some of my own ideas, but I'm too much of a chicken to go out and try and do a startup on my own. I will though soon.
All right. Well, I guess you'll know all about the process, right?
Yeah, for
Everything that
sure.
can be like the minimal viable product, prototypes, everything. And funding.
Yeah.
You might just be able to get funding too, a little easier than someone else.
Well, and I think this was kind of one of the things that we talked about before, Michael, is I've seen a lot of people coming over from the tech industry into healthcare. And I am excited about that for a lot of reasons, and I'm also not excited about it for a lot of reasons. I think it's a really good thing. I think when we can bring in a fresh set of eyes looking at a problem in a new way, it's always a good thing. They can ask all the dumb questions or questions that someone else might think are dumb if you've been in that space for a long time. They can apply, new logic and new thinking to it. But I think when I think about startups in general, whether it's somebody coming from tech and becoming entrepreneurial in the healthcare space, or just somebody who maybe isn't as familiar with healthcare, is that a lot of these startups don't know what they don't know. And our industry is so different than any other industry. To go and bring a product to market in the retail space that's a board game is much different than, hey, I'm impacting somebody's life and maybe their care and how they're going to live the rest of their life potentially, depending on what I'm working on. But we have so many ins and outs with FDA. We have so many ins and outs with just getting market access. Adoption is a huge challenge. There are a lot of barriers you have to overcome with that. And so, for me, I just think the more that we can help each other navigate this process, the better off we're all going to be.
So we got another question from the audience. What have you seen that worked well in terms of community information exchanges as we are seeing more and more focus on social determinants of health? This is a great question. And this is from Matthew Doc Campbell. Thank you, Matthew Doc Campbell.
Yeah, thank you, Matthew. Thank you for stumping me a little bit because I haven't done a lot with the community information exchanges. But I will say, from the social determinants of health side of things, that is a topic that's been steadily talked about for at least the last 5 years, maybe longer. I think it's hugely important, especially when we think about, rural healthcare and other things like that. And we also think, of people in other countries, maybe some of the poorer nations and things like that. So it's hard for me to say, what's worked well in those community information exchanges. I just don't feel like I have enough experience in those to actually answer this question the way that you probably would want to hear it answered. But I do think that we need to continue that focus on social determinants of health. I think that now, so more than ever, it's the time for it. People are ready to rally around it. I think a lot of VCs are more interested in investing in it. When you think about all of the diversity programs and things like that are out there, a lot of folks are wanting to invest in things that are helping, in social determinants of health, regardless of kind of where that lies. So I think now's the time It's just getting there and getting those creative ideas to market and then getting that adoption for it. I think one of the other challenges when we think about social determinants of health, or really any startup in the healthcare space, how do we make sure the hospital systems know about the ones that matter so that they can adopt use of them? They don't have time to meet with millions of startups, and there are a lot out there. They don't have time to meet with them. So how do we do that? How do we get these companies in front of them and really use that in order to make a difference and leverage that technology? And I think there's ways to do that. Some of it is, really just having that liaison within those health systems and saying, hey, what are your needs? What are you looking for? How do I find the exact right solution for what your challenge is? So instead of, going out and trying to create their own processes to put in place, maybe there's a startup out there that's already addressing it, and how do we match those up?
I like that. I know we were talking like 2 years ago when everyone was raising capital, unicorns, but do you see any companies right now that have raised a significant amount in healthcare that if you had your money, you'd say, man, this is something, they got stickiness, they've raised several million, they got product market fit, that's going to be a unicorn? And maybe you can't say you've signed all these NDAs for all the work you do, but is there a unicorn out there that you'd like, some impressive founder or startup that you think that you're really impressed with?
Yeah. There's some things I probably can't talk about, but one of the things that come to mind, and this is, and I will tell you, I haven't looked at any of their competitor, if any of this company's competitors, but I know the CEO, and I really care about pediatrics and autism. And Dr. Sharif Tiraman, who came out of Chalk Children's and is now, he's still with Chalk, but he's also the CEO for a company called Cognoa. They're really making a lot of great inroads on diagnoses for kids with autism. And anybody who has been in that space has heard, or knows that sometimes it can take years for these kids to get diagnosed. And in the meantime, they're just falling to the wayside. They're not getting services. They're not getting the help that they need. And so that's one company that I'm really proud of. I don't know why I'm proud. I haven't done anything for them, but I'm proud to know them, and I'm excited about their journey. I can't give investment advice, but if it was something, if I could afford to invest, that's maybe one that I would potentially look at. But I do think, there's others that I can't talk about. I think everybody has to do their own due diligence on that kind of thing, though. So again, not an investment advisor, just trying to make that very clear. But that is one of the companies that I really like a lot. I think there's a couple of other people doing something similar in the space. Like I said, I haven't really looked into a lot of their competitors yet, but I do really like the work that they're doing.
It seems like with autism, I could only imagine the cost, like caregiving. Like right now, my dad's 90 years old. We thankfully have found an angel, and that is a lot of money to have. So I imagine with autism, there's a lot of costs associated with the care alone, and so that company, yeah.
Yeah, and I think a lot of it too kind of depends on kind of where the child is on the spectrum, but 30 years ago or so, we didn't talk about this. So there are adults out there that are autistic that never knew it or never diagnosed. And I remember even talking to an adult who got diagnosed when he was 30, when I was doing some autism research a couple of years ago. And, I said, how do you feel, about being diagnosed later in life? Was that hard for you? And he actually said, no, it's the greatest thing that's ever happened to me, because my whole life, I've wondered why I had problems connecting with people and why I had problems working with teams when I would be at work, why I always wanted to be on my own, why sometimes my wife and I weren't connecting. And he's like, it answered so many questions for me. And it helped me understand how to better deal with everyone around me, from both my family to my friends. And I think when you think about, kids and the incidence of it's only getting higher. And I think when you think about these small kids and parents who are trying to figure out how do I work with my child, and they're, if they're not listening to me, or if I can't get them to do what I think they should be doing, because as a parent, sometimes we try to do that, even if we don't mean to. I think it would help so many folks. So I think just in caregiving alone for patients and their families, and even inside of hospital systems, I did a lot of research in this space, and I talked to a lot of people at hospitals that gave me some great feedback on it. We think that autism is talked about a lot, so we think that every caregiver knows how to handle a child with autism, but that's just not the case. In fact, kids with autism have longer lengths of stay. They have bigger challenges often when they have to get a treatment done. They're sedated or they're, strapped down, and it doesn't necessarily need to be that way. So I think if we figured out better ways to work with the families, I think that would help a lot too. There's a lot in that space that I could talk about all day long. But I think, when you think about cost, there is a cost when you're thinking about hospitalizations, but there's also that bigger cost of what is it doing, to the child who hasn't been diagnosed and who is frustrated on a daily basis, just in general, and the family around them too.
And I think also just I know Microsoft had some neurodiversity hires. A lot of times some of those who have autism might do well on different areas, whether it be engineering or different things. But it seems like a huge cost is just not being able to connect in the workforce. So I think that in itself is huge, the social. So hopefully there's benefits there. We do have another question.
Sure.
It's kind of there's a huge gap currently in our federal healthcare system. That's kind of abroad. You can take that and run with it.
Yeah. I mean, if we had the dream, we would tear the whole system apart and reassemble it from the ground up, right? I think, there's issues with the federal system. There's issues with payers in general, whether it be from the government or, Medicare, Medicaid, or private payers. There's issues with the way hospitals, get reimbursed, and we've tried different models. And now, the big thing is value-based care. There's just big disconnects. There's huge silos in healthcare. And I think this is one of the things when I was talking about how healthcare is not like any other industry, we just aren't. And a lot of those silos are going to take a long time to break down. I mean, even when I think about, data for, AI models that we may want to use, or even, things like blockchain. So patients have access to their data and they can follow the continuum of their data. People don't like to share. We've got pharmaceutical companies that aren't sharing, or that aren't sharing necessarily with everybody else. We've got payers that want to make sure that they have the maximum amount of money coming in. So maybe they're not always doing the right thing for the patient. I hope that's gotten a little bit better, but we've all heard the stories about bills that should be approved not getting approved and things like that. The system is definitely broken. I think that some of the innovation that we've seen along the way is helping to try to fix that, but it needs. My opinion is we still need a massive overhaul, and how we're going to get there, I just don't know. I think it's going to take a lot of really creative and smart people banding together to get this done. But there's a lot of competing problems in that. So it's not just the desire to fix the healthcare system. It's the desire for everybody. Everybody has a desire to make money too. We got to keep our hospital doors open. We've got to keep our insurance plans in place. We've got to keep, the federal government wants to make sure they're maximizing their dollar for the different reimbursement models that we have. And reimbursement in general is difficult. Hospitals aren't always able to get the right codes in place. There's not, from what I understand, there's not a lot of educational programs for physicians. Like when you're in college, they're not teaching you how to code. And then you're out there in the real world and you've got to work and you've got to go in and code stuff. So unless you're, have the same type of patient every single day and you're using the same, few codes over and over again, that may be a little bit easier, but codes are often wrong. We've got, compliance, coding and compliance teams that look at that stuff, but hospitals leave a lot of money on the table too. So there's quite a few things that could use a lot of fixing in this space when it comes to not only just the federal, but the system as a whole.
Yeah. With COVID passing, what do you think's happened to our overall health system? Do you see that it's improved access, affordability? I mean, tell us what you see on that.
Yeah, I mean, access and affordability are good. I do think that's getting a little bit better because of telehealth and things like that. However, we do have some unintended consequences from that. As far as affordability issue goes, I can afford my care. I'm fortunate. I feel fortunate that I can. My insurance company was trying to get me to use telehealth, so I've done it twice, and both times they said, I can't help you. So both times I had to pay for that visit and then go do another one. So if I and I was not happy about that. So, there could be some of those types of things that happen, but I do think, access is getting a little bit better. There's still huge gaps to fill there though. I mean, especially with rural healthcare is a huge piece of it, but even even for, your everyday person, most people don't understand how their insurance plans work. And even if they do understand it, sometimes the process fails them. I've been trying to get in to get x-rays for something for 6 months now, and I can't get in. And the one time I was able to go, my physician's office put the wrong group on my piece of paper and they were like, oh, we can't see you today because you have to have, your paper has to have the right group plan on it. I'm like, but I have an insurance card here with the right group plan. Sorry, can't help you. So there's a lot of just little dumb things that kind of get in the way of that access that I think still needs to change. I think COVID did help shift that a little bit, and I do think we're going to continue to see that get better. But yeah, it's a tough place. And then I also think, patient coming from a patient access side of things, we don't always do the best at it. It's definitely something that we need to improve. And hospitals right now are in a tough spot. They lost a lot of money during COVID. A lot of them don't have, nearly the amount of cash on hand, days cash on hand that they used to. It's definitely a challenge. And then we also have a lot of folks that are burnt out. And so if our providers all quit and our, what are we going to do? Nobody's going to have patient access then. So I think one of the things that we really need to be looking at, and probably one of the things I should have addressed in the biggest challenge question, is just that. How do we address this burnout issue? How do we find new models of care so that people aren't as burnt out? How do we find ways to provide some satisfaction? How do we create less paperwork for physicians? And there are a lot of startups working on those kinds of things. But until they're here and integrated, it's going to be a challenge.
Yeah, I love that last thought. And it reminded me of our talk last week on planetary health with Dr. Ryan Grant. He brought up healthcare's so boring. We got to make it fun. He's like, he was talking about like going to the primary care and getting that clipboard we all know about and filling out the same information we fill. I mean, are you kidding?
100 times already. Yeah.
So it's some of the stuff is, and then I think as a consumer or patient, getting my x-ray done as well, but really not needing it done and still paying for it while having insurance, and frustrated because I've, at that point, it's really just arthritis, musculatory, and the primary care doc that I had just wasn't good on figuring it out. Physical therapist was great. So I think most of the stuff we probably should be doing some skeletal physical therapy, yoga. But we got some,
for sure.
But when you need a surgeon, you need a surgeon. So we got some more questions coming through. This is another good one from Ashad. What are your thoughts on the future of value-based care? Well, that's a whole nother subject, but maybe if you can, I know we're coming towards the end.
I think it's going to be complex. I mean, I was talking a little bit earlier about, how radiologists, if somebody comes into the ED and they have to look at their scans in 20 minutes, right? There could be thousands of images in those scans. So when I was talking to one of my colleagues who is doing some work in this space, he was telling me about how, sometimes there may be something else, not the thing that the person came into the ED for, but maybe they see something else on the scan. They don't have time to dive into that, and they're not obligated to dive into that because they only have that 20-minute window. They're looking at the scan for that primary thing. But I think when you think about values-based care, if, you're being paid for that covered life, if you can catch something early, so if there's a way that we can use models like AI to help us find other things that might appear in those scans, or use AI to predict what may happen to this person now because they've got diabetes and something else, it may help us capture that patient earlier. Number one, take care of them easier, but then also have that additional, morbidity to attach to that patient, which means they're going to get more the institution that's covering that patient life is going to get more reimbursement. To me, I'm not really sure how this model is going to go in the future. It's going to be interesting to see. I do think that it may be hard for some of the hospitals that aren't able to capture a lot of those other conditions or underlying conditions for patients to get the full value of the care they're providing back. And I don't know what will happen with some of those that are already financially drained. And I think that's maybe a concern that I have. Again, this is another topic that I know just enough about to be dangerous. I definitely am not a value-based care expert. And I do think that that it may take a team of experts to come together and really figure out, is this the best model? And if it is, how do we help hospitals maximize that reimbursement?
Well, I think it was well said, and we can move over. We're kind of coming towards the end, but I think we got several more questions. I love the engagement from the audience. You guys make my life easier, and all, it's just thank you, excellent questions. But this one's more up your alley. And how do we introduce innovation to medical students? So this is an awesome question.
I do love this question. Partner with your universities. Universities have gotten so much better about doing this. I've run hackathons before where I ask, the UCI down the street here, hey, I need some data science students. I need some, bioengine students. I need them to come and participate, and they get those out. And these students are excited about doing it. They just don't know where all the opportunities are. I think, Chalk Children's has a really fantastic summer internship program that kids can get involved in to see if they even like working in healthcare and what part of it is they do like. And I always encourage students and others to reach out to people that you find. When I was growing up, we didn't have, LinkedIn and social media and all of those other things. And I was always told, hey, you can be a nurse, you can be a doctor, you can be a lawyer, a fireman, or stay-at-home mom. Like, those were kind of the limits I was given. It's either like go to school and do one of these things or be a stay-at-home mom. There's so many career choices in healthcare, and I think the innovation side is great. And one of the things when I was at the early stage incubator that I worked at before Alera, we did a program with one of the local universities where we would bring in a real world problem for either their computer science students or their bioengine students to work on. And it was great because they would work on that project in real time. And in fact, one of those projects is actually a product that will very likely go to market. They won one of the awards for MedTech Innovator last year for a pediatric device. And it was a group of 11 people on the patent, and most of them were students from the university. I think students are really important for some reasons. I think some folks that are maybe in the healthcare community might say, well, they can't possibly have the level of healthcare knowledge that they need, but you can bring in experts and mentors for that. You're getting new, fresh ideas, fresh thinking, fresh perspectives from a group that maybe hasn't been in healthcare for 10 or 20 years and is just kind of thrown, and not to say that everybody's been in healthcare for 10 or 20 years has thrown up their hands, but a lot of times it's hard to think outside the box when you've been in something for so long and you've been told, no, you can't do that so many times. So it's always nice to get students involved. And I think there's a lot of ways to do it. And if you ever want to talk to me about any of the universities that I talk to, please feel free to reach out to me. Happy to help with that.
Awesome. Well, we're going to have you follow up a little bit. Next week, we have a follow-up Planetary Health First, Mars Next newsletter. So you'll be able to contact Suzy. We'll give our audience your information. And then the other thing is that you'll be able to maybe recap some things that are important to you that you're working on. And the last question to send everyone off is give us some motivation on startups, those who want to be startups or in a startup. What advice do you give some startup founders?
Yeah, and I would say a couple of things. Number one, know what your business model is, know who you're going after, and make sure that when you're pitching to someone that you stay true to that business model. I think that's a big key piece. But I also think don't be afraid to seek out people that are in the industry and ask them questions. The thing is, like I said earlier, you don't know what you don't know. And regulatory pathways can take a long time. I've had companies come to me and I say, oh, tell me more about your product, or, what does your FDA pathway look like? And they can't articulate that because they don't quite know. There are experts that can help you with that. There are experts that can help you understand the market that you need to go after and why. Sometimes, you're thinking that, hey, I'm going to sell direct to consumer, and maybe the better play is direct to provider to consumer. Maybe it's not. There's a lot of different models that you can use. And I think, how do we get to the right business model, number one? And then number two, how do you understand the buying cycles and healthcare in general? For those of you who don't know, hospital buying cycles can be months, can be almost up to 18 months in some hospital systems, depending on how they're structured. But there are, little things that you can use to try to get your product in. I also think there's something out there called group purchasing organizations and IDNs that if you've got a device that you want hospitals to buy, a lot of times you have to be affiliated with one of those. I'll ask startups all the time about that for when they're thinking about customer acquisition and they've never heard of GPOs or IDNs. So there are a lot of things that you just don't know unless you know to ask. So don't be afraid to ask questions. Don't be afraid to call somebody who has some, knowledge in the space and say, hey, can you help me? And I have people ask me all the time, and I get questions all the time that I can't answer too. There's no way I can possibly know everything about everything. I'm not a regulatory expert, but I know regulatory experts. So I can tell you what my thoughts are, and then I can put you in touch with somebody that actually isn't just knowing enough to be dangerous like me.
That was awesome. So we are going to wrap it off. We are done today. Thank you so much, everyone, for attending, joining us at Planetary Health First, Mars Next. Thank you so much, Suzy.
Yeah, absolutely. Anytime. Thanks, everybody.
Bye-bye, everyone.